So he had a PIP arthroplasty. So they replaced this joint. It was very arthritic, and so they took out all the arthritis and placed in an artificial joint. Looks nice. Do you have any pain right now? And have you been using the exercise splint daily?
Yeah.
All right, so we're gonna get you warm and then we're gonna start with a stretch so I can kind of see how it's moving. All right, let's stretch it. And so right now we're just slowly getting that new joint to move, but we have to be really respectful and slow because of this incision right here. A lot of big structures were cut to get the implant in, and so now we're letting them all heal. And so we're slowly stretching them out. How's this joint been?
All right.
Good. That's not bothering you?
No.
As we start to move your hand a little bit more, your swelling is going to go up and down. All right, so you're going to go flat down. We're going to start to work on that scar. Are you okay with a little lotion on there? So you're going to put some lotion right on that scar, preferably something unscented like an Aquaphor or something like that. And then you're going to start to rub and do little circles all along the scar. Does that feel tender?
Not bad.
Okay. And it's just a minute or two at a time, and if it starts to become tender, just stop. Yeah, I would say 10 to 12 all in to gain functional strength back. And the index finger is hard because you do a lot of pinching on the side of your finger, and so that puts a lot of pressure onto the replacement. So I want you to show me how you've been doing your exercises. Perfect. You gained a lot of motion, huh?
Yeah.
All right, so I'm gonna re-dip this. We're gonna come back in and remold it so we're getting more flexion, okay? We're gonna flex to about 40 degrees, which is 10 degrees more than last week. And every week we're pretty much trying to gain 10 degrees as long as he doesn't have an extensor lag. All right, prop up on your elbow for me. Okay. I want you to bend your finger into that splint. Good, hold it right there, a little more. Good, right to there, and just hold it. Does it feel okay?
Yeah.
Okay. Another second, just while it hardens. Do you have any pressure back through here?
A little bit.
Little stretch kind of feel? Okay. You have to just be really careful with the pinching, making sure you're not pinching. And let's check this to make sure it goes up high enough. And if not, we'll go up even higher. Yeah, get that finger all the way straight. Bend and straighten. Good. Better?
Yeah.
Does that feel better through there, or does it need even more taken out?
Oh, that's fine.
Okay. So you're gonna bend your fingers to make an L with your hand. Yep. And then you're gonna open back up. Good. Yeah, good job. How do you feel?
Good.
Okay. So we're done. So for home, you're gonna do your exercises in your splint with a little bit more motion. Okay?
Yeah.
And you're gonna start to do scar massage. Twice a day, little circles over the scar with some lotion on there. All right?
I'll have my assistant do it.
Perfect.
Oh,
I'm retired, remember? RN retired.
Yeah, she's
I'm
retired.
retired too.